So, why do I have ED or why do I have erectile dysfunction? I'm Dr. Durst and I am a sexual wellness expert. And this is a common question we get in the office, and it's a common question online as well. So, ED is very common worldwide, about 15% of men, and that's of all ages, but about 40% of men at 40, 50% of men at 50, 60 at 60, and so on. So, it goes up with age, and almost 100% of men at the age of 80. And so, are these conversations really happening in the doctor's office? And maybe that's why it's so common online that men are asking why they're experiencing ED and what is it? It really is your dissatisfaction with sex because you should be satisfied with your sexual experience. So if you're not able to consistently get an erection or you're not able to consistently keep it for the whole duration of sex, or your inability to have an orgasm, it's becoming more difficult to have an orgasm. So sex is going on longer than you want it to. Those are all things that would interfere with your satisfaction. So, what causes ED and why do I have it? The penile vessels are the smallest vessels in the body, 1 to 2 millimeters. The coronary arteries are 3 to 4. The carotids are larger than that. So, those are the first blood vessels that are going to be affected. And so it's almost a barometer of vascular health. So when we take blood pressure in the doctor's office, we should also be talking about erections because that's a barometer of how your vessels are working. So one of the things that can cause, and one of the reasons you might have it, so some lifestyle issues are if you're a smoker. That can actually affect blood vessel health and decrease blood flow to the penis and therefore affect erections. Obesity is another one that can affect erections. So those are two common lifestyle issues. Why? So you need to be more active. And if you are a smoker, you need to work on decreasing that or stopping. And then blood pressure, obviously, as we get older, our hormones decline, inflammation in the body happens, and then that's when all of our diseases start to develop. So basically, hormonal decline is one of the things that can cause erectile dysfunction. So getting your hormones checked. High blood pressure is another thing. As we age, our hormones decline and that inflammation happens. High blood pressure will happen. Abnormal cholesterol panels, insulin resistance are all things that can happen. Those are pretty common. Cardiovascular disease, high blood pressure, those are common issues. Diabetes, insulin resistance, obesity, smoking. Those are all things that can either be checked early on by your primary doctor, and a lot of those lifestyle interventions can affect those disease processes as well. But it's important to get your hormones checked because that's one main player in erectile function as well. So hopefully that answers why. If you want to talk more about the things that we do to improve erections, then we can do that. And we've done lots of videos in the past on that, but we'll address those regenerative procedures and some things you can do at home to improve erections. But what I want to know right now, and I'm curious about, is what kind of conversations are you having with your doctor? So if erections is a concern of yours, and I know it affects relationships and it affects how men think about sex, and it's bothersome, when you start to notice changes and you want to know how to improve that, are you having those conversations with your doctor? Are they asking you those when you go in and you're getting your vital signs done or you're having that initial intake with your doctor? Are they talking about erections with you? And if you have opened those conversations, what kind of solutions are they offering? So I would love for you guys to start and to open some conversations in the comments and let me know what conversations you're having, what you're being told, what solutions are being offered. Please share so that we can open those conversations. And again, if you want to hear anything else, just let me know because I am willing to deep dive into anything sexual wellness.